Hey there, welcome to Crew Talk by Health Crew HQ. I'm Shelby, and we know that in the world of digital health, there are thousands of pitches flying around everywhere. It's hard to sort through the white noise of all those pitches, and at Health Crew HQ, that's our goal. We want to help you sort through all that. One of the ways we do that is right here on Crew Talk. We ask an innovator to come join us, 20 minutes, and the idea is to help us look at innovation beyond the pitch. So welcome. Let's get into it. Today, I am sitting with Dr. William Ferro, founder and CEO of Betr Health. Dr. Ferro, thanks for being here. How are you doing?
I appreciate you. Yeah, I'm doing great. Appreciate you having me. Thank you.
Awesome. You want to tell everyone a little bit about yourself and maybe like what show are you watching? Are you binging a show right now or anything like that?
Um, what show would I be watching? I'm not really a show watcher, so I do digest a lot of podcasts, and at
Okay.
night, and at night I try to I'm just active background. Yeah.
Cool. So when you're not listening to podcasts, what are you doing at Betr? What are you all working on?
So we are empowering people, every single type of person you can imagine from all walks and seasons of life to actually start falling back in love with their own body and dispel the myth that, they can't do it. So I think when people say, what do you really do there? I take people from, I don't think I can do this to this is who I am now. And if we're really good to now I'm actually helping others do the same thing.
Love it. That's cool. I mean, I'm in rooms a lot with health plan leaders, health system leaders, employer benefit leaders. And the number one thing that they're all talking about right now is budgets. And one of those things, eating budgets, chronic disease, GLP-1s, all that stuff's going through the roof. I'm sure that's what you're seeing in that. I mean, that's kind of the space that you live in. Talk about that a little bit.
More man-made chemicals to help more man-made diseases. That's the ticket.
Yeah, that's right. Well, it keeps everyone in business, I guess.
I'll ask you, how's it going for us? 60%
Right.
of us with a chronic disease, 40% with two or more, less than 8% of us are metabolically healthy. How is this going from us? So I would say the next time someone says the word budget out loud, I want them to change the B to the word belief because it's their belief system that really needs to shift. The budget will come along.
What do you mean belief system? What needs to should I mean, I've heard you talk about how we've almost like normalized chronic disease. Is that kind of what you're talking about?
Absolutely. I mean, if you stop labeling the body and start asking why the body's responding this way, it's a much different equation. Let's just face it, resolution isn't billable. So, of course, as the employer who has no shot at, the budget's going up, but they have no chance to affect this because the system that's billing for it is incentivized to keep billing for it. So they're really at a loss.
So when you're passionate about this, you see this big problem that's a gap in the system. Is that what led you to Betr?
Yes. Short story. I was a chiropractor, put chiropractic offices in gyms. I had 30 of them across the country. I added every modality you can imagine. I thought I was the smartest person on the planet. I had personal training, physical therapy. I was doing poop tests, saliva testing, and yet people weren't getting better, which led me to the fact that, hey, you know what? Maybe it's not their back, it's their front. So I started looking at the foods we were eating and started researching more and didn't realize our rainwater was being polluted, our chemicals, the pesticides, the fungicides. We're doing everything we can to kill ourselves off as a species. And yet all we do is focus on downstream, creations to fix what our body's just signaling that it doesn't like.
Do you feel? I mean, as you're navigating into Betr, is it receptive? Is it like what's the biggest obstacle? I mean, there's so much change that it would require in behavior, and I hear a lot like, "Well, that's my people aren't going to change. It's too hard to change." Heck,
Yeah,
I've tried losing weight, and once it becomes summertime, that's time for margaritas. I ain't stopping.
sure. Well, people don't fail. It's their environment that does. So every single day you are not consuming just the food, you're consuming your environment. And so trying to just push behavior change when the environment's not changing, yeah, that's going to seem difficult. And I think we're villainizing people too much. So for us, it's not about never having margaritas again. That's why we call the company Better, Not Perfect.
Oh, heck
Having
yeah.
slices of pizza
All right.
with your family, but it's focusing on something much different. Your body's amazing. Your body can heal. Your body can deal with a margarita. But what it can't deal with is the chronic exposure to the chemicals in the systems. And you need to add in some foods, some proactive foods that are short chain fatty acids, things that are going to, help the soil of the body, and just let your body do what it's designed to do. So the belief I'm trying to change is everyone has that little voice like, change is too hard. We've tried this before. People are lazy. They're unmotivated. No, they're actually being poisoned at the cellular level, and your body's reacting exactly the way it was designed to do, which is they get poor cravings, get lethargic, low energy, and yes, stress, cortisol levels go up. And guess what you crave during those times? Sodium, potassium, and sugar. And then our behavior change model is punishment. Well, you've been really bad. So what we're going to do is we're going to flip tires in parking lots, drink shakes, and exercise until your tongue falls out of your head. And when that doesn't work, we're going to call you a bad person and then give you polypharmacy for the rest of your life. Been tested together, and suddenly you're 65 years old, 75 years old, and all your conversations with your friends are, which doctor you go to? You go to that podiatrist? You go to this one? That's what we're doing this for? I have to change the belief. My program, my process, that we've all nailed down the last 15 years. I'm there to change people's beliefs.
And are you seeing as you're navigating? Well, I actually have two questions, and we didn't talk about this, but is this a worldwide problem? Is this an American problem? What's your perspective on that?
Interesting. If you talk to, I was just actually talking to a guy last night from Germany, and we talked about how he lives here now, and he tells his daughters, you can buy any, you can use any like makeup products you want. They just have to be from Europe. Uh, but I said to him, I said, well, you moved here, what happened? He goes, I gained probably about 15 to 20 pounds within the first 3 months of being here. And that was in 1995. And I said, well, is Germany still, healthy and things? Like, no, even those countries now are having issues, right? Because our Western foods have seeped into that culture, and the fast food culture has gotten there. So it is worldwide.
Yeah. So you're up against you're up against the current of the world, and easy access to this type of stuff. Some of it, it's like I was talking with my family about just health and what is being put in stuff, and it's like you can't even go to the grocery store. You don't know what to buy. You know if there's pesticides in there. I mean, so you're up against the whole world here.
For sure. And you actually, even further than that, as of 2015, the scientists came out and said the rainwater, okay, I want everyone to hear this, the rainwater is unsafe for human consumption everywhere in the world. You can grab a glass of water in the Antarctica, and it's going to fill, it's going to have PFAS and chemicals in it. So we have to stop thinking about all the miraculous apps and functions and programs and medications and peptides and this and that, and say, they're poisoning the water. We have to fix the water.
Yeah. Okay. So you see the tension. You're up against the world. You say, all right, we're going to build a better program here. You touched on it a little bit, but just make sure we're all clear. High level, what is better? And then I'll ask you to just walk me through what happens when a member starts this journey with y'all.
Okay. So important to just know the three things we're up against when any member comes to us is they've been told it's their lack of willpower, lack of motivation, or genetics. I want everyone to realize here that genetics just loads the gun. Your environment and your epigenetics is really how you express those genes. So if you think it's your fault, or you have a poor relationship with food, or this just runs in your family, I want you to get nothing more from this podcast than it's not your fault. And your body can react much quicker than you've been told just by removing the confusion. So day one at Betr, we're removing the confusion. We're saying, we're just going to start on a 3-day trial of these foods. And if you just add these foods into your body for 3 good days, you will see your body respond. That's how you'll know it's working. So by getting on the phone with a coach and getting all the confusion, say, just stick to this plan. We always start on an upcoming Monday, give you the weekend to food prep. If you can't food prep, we have a nationwide meal delivery service that, by the way, is at cost. It's not a profit center for us. We do everything we can to give you all the resources and tools to just do those 3 good days. And when you do those 3 good days, something happens. Your body responds.
Yeah, you get to see the actual work happening, and maybe self-motivating at that.
Absolutely. Weight comes down, sleep, energy, something happens those 3 days. I call it my Tuesday night guarantee because I do a Tuesday night live Zoom call every Tuesday night. And I say to the world, everybody, jump on that call for free. listen to the stories of everybody else. And if you start my program and say, this isn't for me, if you're a direct to consumer, we refund you on the spot. If you're an employer group, we only charge for outcomes. So we've basically made this the no-brainer of no-brainers because I believe so much in the body and so much of that. Take those 3 good steps, 3 good days. And after 3 good days, like you said, now they have a call on that Thursday or Friday of that week with the coach. Coach is pretty good, huh? Yeah, I can't believe this is actually working. I'm not starving myself. I'm not counting calories. I'm just eating good, healthy foods and I'm feeling better. And then we make sure they get through that first weekend. So they have a plan to get through and have the meal prep. And so we are building habits and strategies and resilience strategies over the next 3 weeks. And then we do something crazy. We bring back in certain foods one by one. So Shelby can figure out what works best for them. Sarah can figure out what works best for her because there is no one size fits all. So I think you said the word right off the bat, confusion. That is what most people come to. We eliminate all that confusion in 6 to 8 weeks. And then after 8 weeks, they're like, this is just who I am now. And that is really the powerful part of it.
So that first 3 days isn't like a hard fast. And that's like
No, it's beef, chicken, steak, shrimp. Your kids can follow along. It's not counting calories. We actually teach you to make this stuff in bulk. So it's short chain fatty acids, high fiber, good protein. Just remove chemicals. Season it with anything that you want. Just you'll have to give up alcohol, artificial sweeteners for 3 days. So anything chemical or alcohol related, we say just refrain from that for 3 days. If you're a smoker, we're not going to tell you to suddenly give up smoking. If you love your coffee, we're not going to tell you to give up your coffee, right? We just don't do those extreme things because your body is just dying to signal you, this works. I got
yeah.
this.
Okay, cool. So you've done this for how many, 15 years? Is that what it said?
15, it's been formalized for 15 years. I've been doing it a little bit longer than that, but 15 years is when I took it out of the clinics, those 30 clinics, and created a formal program that you could do online.
So as you think back as Betr has evolved, I'm sure you've got, tens of hundreds of amazing stories, testimonies of how this has changed. Give me one of those stories of a real client that worked and went through the program and came out the other side just glowing.
I want everyone to know that the way I approach this, my coaches approach this, is that we treat everybody like it's your uncle, your sister, your mom. This is such a tight community. And the reason why it grows that way is because my coaches are former clients. So the story that I'm about to give you, it's actually more than just her story. It's the story of the coach who coached her, who also had a story of her own. So this is a really amazing part of this because you're actually building a social construct around helping other people. So the person I have in mind, the reason why it's in mind, I just put it on LinkedIn yesterday. Her name's Christina. And Christina's a mom of 4 and was scared to eat breakfast. Every single day, scared to eat breakfast. Why? Because she had IBS in her mind, went to the doctor, and the worst thing happened when she went to the doctor. All the tests were normal. Okay.
Yep.
Right. Yet she can't figure out what's going on with her. So it's a wonderful video testimonial she gave. But the gist of it is she started following the protocol. 3 or 4 weeks later, blood pressure down 16 pounds, no more pain, no more bloating, can go to her kid's soccer game without worrying where the bathroom is. And the coolest part is she says, I grabbed my grandmother's ring and I could finally put it on my finger again.
That's awesome.
Her antique ring. And she said, I was just about to have it resized because I had worn it over a year.
Wow.
So, and when I tell you that happens every single day, because with Betr, it's not that we're saying it's so easy. It's just so hard to fail, because if you start for those 3 days and something happens, your kid gets sick, you didn't fail. We start you again next week and we start you again next week. So in our model is you have a year to get through the protocol, and it's on us to get you through that protocol. So you outsource it to us. We'll help you get through it. If it takes 3 tries, 4 tries, most people get on the first or second try, but there are people that take 3 or 4. And then when they do, though, it's so impactful because they say, you know what? I learned from that stumbling block and now I'm able to have resilience.
That's cool that you go through it and then often you're seeing them coached, because I'm imagining that keeps them encouraged, keeps the coach now, sticking to the plan and staying in the community and stuff. What's your, as people graduate through the plan, do you see people fall back into old habits? Talk about that a little bit.
Yeah, so resilience is definitely the key here. So when someone is finished with the program, we help them build in quarterly resets. So just like you would like check back in with yourself, so we have them build in quarterly resets. But people do go up and down, right? This is life. I myself, a human being, get stressed with work, and the next thing you know, I'm like, I gained 7 pounds this week because I was traveling and whatnot. We're all in the same boat. No one's different. I'm not like a men's health fitness guy with 16-pack abs and all of that's. We're all in this together. And so when people do this, they always have the community. So we have group calls happening 7 days a week. We have the Facebook group. There's always a way to tie them back in. Plus, because we give them a cellular enabled scale and the technology, if we see somebody's engagement dropping off, not tracking on their weight and these things, we reach out to them with human support. But I want people to understand there is no in your life. It's kind of like being an entrepreneur or success. You don't own success. You rent it, and rent is due every single day. And the same thing has to do with our health. So we teach people that if you're having trouble, you get it, just come back and we'll do a reset and get you right back to where you need to be.
Love it. That's cool. So seems like a great program. You've seen a lot of success. I've met some of these clients have gone through it. I got to meet you all, I guess, last year and watched several of members come through, connect with you. It seemed like there's a lot of good traction there. Now let's talk to some of our listeners. So we have health plan leaders, health system leaders, employer benefit leaders. When you're navigating those conversations, what are some of the biggest hiccups? What do you want to tell them as they're thinking about this whole topic?
Yeah, we made it really easy for them. We understand that adding anything right now, when you have budget constraints, you always think, first thing you think is more dollars. Is this really going to give me an ROI? And then you're also thinking, how hard is this going to be to implement? Like, there's just so many things, and your belief system is, I don't think it's going to work anyway. If they're true, if they just said what they really felt out loud, they'd say, I don't think it's going to work. I think it's a nice to have, is what they're thinking.
Because they've seen that. That's how many plans have come through. They've seen it.
Yeah, and then the per member per month model and all that stuff. So what I do is I say, we've put this we've built the whole playing system for you. We're going to give you a link. You're going to give it out to 25 of your staff. They can link the first 25 that come through. We'll let them go through our program. We'll show you on the dashboard, not their personal data, but just their population health data. And we'll show you in 60 to 90 days how their PHQ-15 changes, their weight, their BMI. And then we're really good at curating video testimonials. So we give the person back this scissor reel and say, hey, this is something you can walk into the CFO's office with now and say, look what's happened. We've gotten 25% of the people to come off medications. We de-prescribe GLP-1s for 5 or 10 of these people. That's saving you $100,000 a year just right there. So we basically prove it first so that they can look like a hero. And then what's great is that first 25 are the ones that can bring it out to the rest of the population. So it gets natural traction, not a lot of fanfare. You don't need the carrot and stick anymore. It should go naturally. And we can either do, because we're a pay for performance or value-based care, we only get paid if they hit 5, 7, 10% weight loss. We only get paid if they come off medications. So we've made it the no-brainer of no-brainers, or as like we like to say in New York, an offer you can't refuse.
Love it. Love it. I mean, that's cool. It's good idea. I mean, everyone who's working in here, they look around, maybe themselves is like, hey, it'd be cool if just us as a team tried this experiment. Then all of a sudden you've got, Susie in accounting who has a real testimony for you, becoming a big advocate. That's a cool plan. Well, Dr. Ferro, that's all the time we have. I want to say this. If you are interested in getting connected with Betr, you could do that. You can check out their whole profile on our website, healthcrewhq.com. I can get you in contact with them. It has been a fun time getting to hear about you. I know, I see, and I've watched you you're not one of these founders that are coming in for a year, 6 months, and then on to the next thing. You've been talking about this for a long time. You're passionate about it, and it's been cool to hear your perspective.
Thanks, man. I really appreciate you having us.
Yeah. Well, thank you all for listening. I am Shelby. This is Health Talk with Health Crew HQ. Love you all. Peace out.